Hello everyone, welcome to our channel. In this video, I am going to explain the right way to use eye drops with maximum efficacy and minimal wastage. So, whenever the doctor prescribes an eye drops, just buy the brand which was prescribed by the doctor and check the expiry date. And one more important thing is, once we open the bottle, we should use the eye drops within a month. And after a month, we should discard the eye bottle, and we should not share the eye drops with any members in the family. And coming to the topic, before using any eye drops, we should wash our hands and we should shake the bottle for at least 10 seconds. Shaking the bottle mixes up the ingredients, thereby increases the efficacy. If it is a new bottle, please don't pierce the nozzle with safety pin or sharp objects. Piercing with safety pin increases the contamination. So, how to pierce the nozzle is clearly mentioned in the manual. Please check it out and do the necessity. And later, remove the cap and place the cap in a tissue paper or on a clean surface. And later, pull down the eyelid and lift the chin gently so that it gazes up to the ceiling. And later, squeeze the bottle so that a drop of eye drop will fall into the eye. And now comes the question, how many drops we should place into the eye? Basically, our eye has the capacity to retain a maximum of 1 drop. So anything more than 1 drop results in wastage. Maximum we can place one eye drop into the eye. And while placing eye drops, please don't shake the hand during placing the eye drops. And after placing eye drops, gently close the eyelid without blinking. Blinking of the eye flushes the medicine from the eye into the nasal cavity, thereby reduces the efficacy. So please, after placing the eye drops, gently close your eye without blinking. And the other important thing is, after placing the eye drops, we should place a finger at the junction of eyelid as well as the nasal cavity. This junction is called as nasolacrimal duct, which is nothing but it is the passage between the eye as well as the nasal cavity. So blocking this area by placing a finger for 30 seconds thereby improves the retention of the medication and thereby increases the efficacy. And after placing the eye drops, if there is any excess, just wipe out away with any tissue paper and a clean cloth and close the eye cap. You can place eye drops at any position, like while sitting, lying down, etc. And while placing eye drops, we should not touch the nozzle with finger. And if doctor advises to use 2 or more eye drops, first we should place 1 eye drop, and after an interval of 5 to 10 minutes, we should use another eye drops. And if doctor advises any gel or ointment, we should use this gel or ointments at the end. And other important thing is, if you are using any contact lens, just remove the contact lens before placing the eye drops. This is all about the right way to use eye drops. Hope you like the video. If you like the video, please share and subscribe. Thank you.